everyone, my name is Alicia Jackson. I'm a licensed professional counselor, and today we're going to talk about what to expect in therapy. Going to therapy can be kind of scary, and don't really know what to expect, and it's a all eyes on you kind of thing. So I want to give you hopefully, some ways and things to know about what to expect on your first therapy appointment or even therapeutic process to hopefully calm some anxiety. It is a brave act to say that you're going to speak with a mental health professional and focus on you. That's truly a brave act. So if you are considering it, you should definitely be proud of yourself. So one of the ways is, of course, choosing a therapist, and you want to, and you do know, I know if you don't, may not know that you have the option of having like a 5 to 10 minute consultation. Can be over the phone or even video now with telehealth being all the rage. But you can ask them questions, how long they've been doing therapy, what type of therapy they do, if you're looking for a specific therapy or treatment modality. Also, want to know if the person has any experience working with the area that you're looking and seeking therapy for. So you want to get a feel for their personality. Of course, every therapist is different. Some are more quiet, some are more talkative. There's a lot of course, cultural things to consider as well. So, in age and gender, all of those things. So definitely use the consultation as a way to fill them out. Once you make your decision of, hey, I'm going to give this therapist a try, of course, you need to give them your insurance information or discuss payment. There's private pay as well. Some therapists take strictly private pay. Some therapists do just strictly even insurances, and some do a mixture of both. So make sure that you discuss fees ahead of time and that you have your insurance verified ahead of time. The reason why I recommend this is because some insurances have deductibles and also have a kind of a fluctuating copay payment. So you want to make sure that you know any out-of-pocket costs for therapy ahead of time. When? Ahead of time. Because therapy is already going to be a journey. It's going to be a journey. It's going to be some challenges, and you don't want any more surprises as much as possible. And one of those things is payments. So you want to make sure you know all of that information ahead of time, and you talk about that with your therapist. Of course, there's going to be intake paperwork. Depending on the practice or agency, if you're going to maybe a community mental health agency, that's completely different. That's through like the state of Michigan and federal guidelines. There's a lot of paperwork if you have state insurance, and so pack your patience with that. Because I worked in the community mental health sector, so it is time consuming, but it's also very valuable. There's a lot of services that you have access through community mental health. If you are doing a private practice, there's paperwork they most likely will have you fill ahead of time, and please do so. Because that's really important. The therapist will most likely review it before your session and be able to discuss and review with you at the intake appointment. During the intake appointment, there are going to be lots of questions as the therapist wants to truly kind of give you get a feel for what's happening and what you've experienced in your life, and get what we call a preliminary diagnosis. Unfortunately, and us therapists, well, I'll just speak for myself, kind of have a love-hate relationship with this. Truly, it takes a more than one session to get a diagnosis. For someone, it may not be all the way accurate, so that's why I say preliminary diagnosis. Once you continue to work with the individual, then you get to know exactly what the issue or what they might be truly dealing with. But insurances want a preliminary diagnosis, so there are going to be lots of questions in regards to that. It may not be as warm and fuzzy as you would want a therapy appointment to be. I myself try my best to make the person feel warm, make it more of a conversation, not so stuffy or interview like, or like they're being interrogated or under a fire squad or anything like that. I want to make it as warm and inviting as possible. Some things to know is that they're going to be asking you about your family history. So that's health and mental health. So if you don't know those things, you can ask. Ask before you go to the appointment. Any family members that do you know if you have ever been diagnosed with a mental illness or ever been diagnosed with any serious physical health conditions, because physical health does impact mental health as well. And also some serious and even sensitive questions that we will ask in any trauma history. So just prepare yourself for that. That is going to be a part of the interview and intake process. But we, again, try to be as sensitive and responsible when talking about trauma history and trauma in the therapeutic process. So, because we are in the pandemic, telehealth has definitely increased, of course, for safety purposes. And so there are some therapists who are doing in-office, face-to-face appointments and feel comfortable, of course, and some therapists who have elected to do strictly telehealth as well. So, and some who do both, because depending on if the client is feeling comfortable with doing telehealth versus coming in the office face-to-face. So, when doing telehealth, tips. Tips, of course, are one, using either a laptop or a tablet. Reason why I recommend that, some people do use their cell phones because we're using apps, typically like Psychology Today has as a telehealth application, DoxyMe, Zoom, all of these sites do have their own, and therapists will use ones that work for them. I fluctuate between Doxy and Zoom for myself, but you make sure you utilize, again, a laptop or a tablet, more secure Wi-Fi connection, and it's less distractions. People are going to be calling you and texting on your phone, which could cause there to be interruptions. This is your hour. You are paying for this, or your insurance is paying for this. Make sure you have, no interruptions on your phone. Sometimes you put on do not disturb, but the call or the text message still comes through. So if you have access to a laptop or a tablet, utilize it for your therapy sessions. Also, if you do not have privacy or a private area in your home, you can utilize your car, go drive to a park maybe. Of course, if it is safe, doing this during the daytime. But make sure you're, of course, safety precautions, please. But utilizing your car for privacy, because you want to make sure you have a private place to talk to your therapist. So confidentiality is important. You can utilize headphones as well. Headphones is a must. One, it just helps you and the therapist hear each other, and there's no outside noises interfering with the session. So those are some just brief tips for telehealth and what to expect in those sessions. In the office, the therapist, of course, you want to make sure you know where they're located, and also that most therapists do have a couch. If you want to lay on it, you can. If you don't have to. They have, depending on their office, they also may have, of course, just a chair that you can sit in. So it does not have to be the typical lay on the couch, the person with the notepad. Oftentimes, the therapist, if they are jotting notes, it's just for their clinical documentation. So we have to note every appointment we do and document that for insurance. But typically, that of course is HIPAA compliant, so it is privacy protected, and your information, your clinical information, medical information, is not shared with anyone. So once you do the intake appointment, they'll hopefully talk with you about the preliminary diagnosis and what they're seeing. Then you guys will talk about and form treatment goals. Now, you are the author. You are the author of your treatment goals, the therapist can recommend what they feel is best or what they feel is the area of importance or area to focus on in therapy. You as the client could say, I want to work on that. And the therapist will say, okay, I just want to let you know what my recommendations are from my clinical perspective. They might say, well, hey, can we do some just education about this? You don't have to say this is something you want to work on, but let's just learn more about it. And, depending on how open you are to it. And treatment goals, you will kind of see and map out how and what treatment will look like through the course of therapy, and then how will you know when it's time to end? How will you know when it's time to know when you've gotten what you needed from therapy and when it's time to move on and glow and grow in your life? I hope this has helped and help you get a clear understanding of what therapy is like. It can be scary. People can definitely have a fear of being judged, being ridiculed, and sharing the intimate details of their life that they really don't share with anyone else. But truly know that therapists, we are here not to harm, not to judge, but here to be a safe space, an open space for you to grow and glow and be transparent and vulnerable, so that you can get what you need to live your best life. Thank you guys so much for listening. Of course, feel free to like and subscribe to my channel. And I have a YouTube, of course, I have a Facebook, Instagram, and Twitter page, all Alicia Jackson, LPC. Be sure to follow me there. I do Monday weekly lives and on my Instagram and Facebook page as well as these videos. So definitely check me out there. Thanks so much for watching and have a good night.